Well, of course I could. Lyme disease is a rare disorder which occurs whenever you eat so much of the fruit of Citrus aurantifolia that you start misspelling the names of other illnesses, such as Lyme disease. Lyme, damn it, with a Y! Coming from Old Lyme, Connecticut, where the disease was first described in the 70s as a separate entity. The disease itself had been around for much longer, we're talking centuries, but its various symptoms were, and still are, rather inconsistent in their appearance, and the causative agent is so hard to detect that we just couldn't put the puzzle pieces together before. I mean, can you blame a doctor in the early 19th century for not figuring out that Mrs. Egbert's facial palsy has the same origin as Mr. O'Neill's knee pains and the rash on little Tommy's tummy? After all, we're talking about a world where commercial toilet paper is science fiction, but vampire hunting kits are real. We know now that Lyme disease is caused by bacteria of the Borrelia genus, so it's more elegant to call the illness Lyme borreliosis. The species Borrelia burgdorferi, or as his drinking buddies call it, BB, had been the only known culprit behind the disease for long years in the past. However, as time went by, other guilty Borrelia species have been discovered too. We refer to them collectively as, well, also Borrelia burgdorferi, but in the broad sense. Nothing else was available during the great bacterium name shortage of the 80s. BB is prevalent in the northern hemisphere under moderate climate, and the only natural way of getting infected is by the bites of infected ticks. So not by petting infected dogs or infected people, not even if they bite you. And ticks, of course, get infected through biting infected hosts, with rodents being the main sources. Many vertebrate species can contract the bacteria this way, but only few are known to actually show symptoms. Humans, dogs, horses, and several animal species used in laboratories are among those, but cute cats, for example, aren't. Lyme disease in humans can come with a huge variety of symptoms: skin rash, arthritis, paralysis, brain damage, cardiac and ocular issues, you name it. The incubation period may take days, weeks, months, or even years, and the severity of the disease ranges from mildly inconvenient to skydiving naked strapped to a bear inconvenient. While people usually become ill after infection, dogs appear to be more resilient to BB, with only 50–60% of infected animals actually developing symptoms according to experimental studies. In practice, however, this number seems to be even smaller. Much smaller. Probably because symptoms are often mild and overlooked, or go away before you'd notice them. Like, can you tell what's wrong with Priscilla? Apart from the obviously neglected oral hygiene. Probably not. Furthermore, dogs not only show symptoms less frequently, they also don't have as many forms of the illness as humans. For example, the early signs that are common in people are generally absent, so no bullseye-shaped rash Lyme disease is so famous for. Dog Lyme comes in only two forms really, as intermittent arthritis like in the case of humans, and rarely as a kidney disease not seen in people called Lyme nephropathy, which is usually fatal. To be frank, we're not sure the latter is really a Lyme thing, as it hasn't been experimentally reproduced so far. The mechanism by which BB infection would damage the kidneys is not fully understood, but we suspect the damage isn't directly caused by the bacteria, rather by a misguided immune response. The existence of cardiac forms of Lyme disease in dogs is not supported by strong evidence. Some experts say it's real, others are not convinced. There's even less to suggest the existence of neurological forms. Even if they exist, BB couldn't be established as the cause so far. Okay, so Lyme disease sucks, but how does one reach a diagnosis? How can the veterinarian tell if your dog's knee pain is caused by borreliosis and not by excessive Irish folk dancing? Not easily, that's for sure. Diagnosis is far from self-evident, and several factors have to be weighed against one another because A. Borreliosis is not the only illness Lyme symptoms are characteristic of. B. Symptoms may take a long time to appear after initial tick exposure, so a causal connection isn't bloody obvious at the first glance. And C. Diagnostic testing for Lyme disease is much like modern art. Interpreting it is tricky. A Lyme test result might look like one thing to the uninitiated.
It's a shoe.
But something wholly different to someone familiar with Lyme. Clearly, it's the suffering of Genghis Khan's butt cheeks. This usually makes those who want answers right now, or preferably yesterday, angry. So how do medical professionals come to a conclusion? They consider the probability of tick exposure, even if the patient can't report on a tick bite because they're just a dumb chihuahua that can't talk. They consider and investigate other illnesses with similar symptoms. They perform diagnostic tests and maybe feel even more confused afterwards. And if they're still none the wiser, they can always attempt treatment with antibiotics. Not like this will provide much info, but hey, it might just work and a happy patient is what you're after. No, you don't do that! Jesus! What happened to the responsible use of antibiotics? Go back to step 3. Ask a Lyme nerd if you have to.
Not happening. She played patty cake with my husband.
Fine. Antibiotics it is then. But you got to be at least 91.56 plus pi% sure it's Lyme disease.
Pie.
Time is up, but there's way more to Lyme disease, so we'll continue the discussion in the next episode. The technical information in this video was fact-checked by Catherine Rife, expert in all things tick. I thank her very much.